my children or my siblings.
Cora Alma De Leon.
Magandang hapon sa inyong lahat. Ngayon po ay ang ating programang Bago ang Lahat, Mamamayan muna. Please like and share our live video. Also, and our FB page, Broad Stream Cast Communicators. You may also follow me on Facebook at Cora Alma De Leon, or you may contact me to my cell phone 0918-912-3546. Narito na ang ating co-host, ang ating inang guro, Sonia M. Rojo, at ang ating guest, special guest from World Association of Psychosocial Rehabilitation, Dr. Cho Chong Tan. Shortcut, Dr. Tan. Tama? Sisimulan na natin. I hope I have an opening prayer for the nation. Lord, let me be the change I want to see, to do with strength and wisdom all that needs to be done, and become the hope that I can be. Set me free from my fears and hesitations. Grant me the courage and humility. Fill me with spirit to face the challenge and start the change I long to see. Even if I'm not the light, I can be the spark in faith, service, and communion. Let us start the change we want to see, the change that begins in me. At kasama nito ay yung ginagawa nating panunumpa sa watawat na ginawa ko for 34 years while I was in government. Ako ay Pilipino, buong katapatang nanunumpa sa watawat ng Pilipinas at sa bansang kanyang sinasagisag na may dangal, katarungan at kalayaan na pinakikilos ng sabay ng makadiyos, makakalikasan, makatao at makabansa. At katulad ng dati, ginagawa ito ni Dr.Reymund Arcega, babasahin ko yung panunumpa ng kawani ng gobyerno. Ako'y kawani ng gobyerno, tungkulin ko ang maglingkod ng tapat at mahusay. Dahil dito, ako'y papasok ng maaga at magtatrabaho ng lampas sa taktang oras kung kinakailangan. Magsisilbi ako ng magalang at mabilis sa lahat ng nangangailangan. Pangangalagaan ko ang mga gamit, kasangkapan at iba pang pag-aari ng pamahalaan. Pantay at makatarungan pakikitungo ko sa mga lumalapit sa aming tanggapan. Magsasalita ako laban sa katiwalian at pagsasamantala. Hindi ko gagamitin ang aking panunungkulan sa sarili kong kapakanan. Hindi ako hihingi o tatanggap ng suron. Sisikapin kong madagdagan ang aking talino at kakayahan upang ang antas ng paglilingkod sa bayan ay patuloy na may taas. Sapagkat ako isang kawani ng gobyerno at tungkulin ko ang maglingkod ng tapat at mahusay sa bayan ko sa panahong ito, ako at ang aking mga kapwa kawani ay kailangan tungo sa isang maunlad, masagana at mapayapang Pilipinas. Sa harap ninyong lahat, ako'y taus-pusong nanunumpa. At dahil dito, simulan na natin ang programa sapagkat we only have 1 hour and about 5 minutes of that, pine-prepare natin for our closing. So, ang ating inang guro, ang unang magsasalita, magpapakilala at sasabihin niya ano ang kadahilanan bakit tayo may programang ganito. Sonia, go ahead.
Magandang hapon po sa inyo, Cora Alma De Leon, kay Dr. Cho Chiong Tan, at sa lahat ng mga masunod na tagapakinig ng programang ito. Ang programang ito ay ang pamagat ay Mamamayan. Ganun ba yan, Cora? Is that the full title?
Bago ang lahat.
Bago ang lahat.
Mamamayan muna.
Mamamayan muna. So, sa pamagat lamang po ng ating programa, ay nakikita natin na parang service orientation po ang ating programa nito. At kaya, siguro isa o 2 taon na si Cora nag-online nito, ay marami na siyang naanyayahan ng mga guest speakers, ng mga speakers online na maraming natutunan na kaming mga tagapakinig dito sa programa ito. Kaya ngayong hapon nito, sabik na sabik kaming mapakinggan kung ano ang matututunan namin galing kay Dr. Tan.
Okay. Dr. Cho Chiong Tan wants to be called Dr. Tan para shortcut. Kasi pag na Cho Chong, medyo mahirap sabihin kaya madali na yung Dr. Tan, sabi niya. Siguro Dr. Tan, bakit kayo naging doktor? Unang tanong. Why did you become a doctor?
Yes. Well, during my young age, of course, it's my interest in science, and also one important, my mother, died at very young age, died of stroke, and because of this, I made a kind of commitment to take up medicine to help treat patients. So that's
where did you do your schooling ng medicine mo, pag-doktor mo?
Yeah, I first after my high school graduation, I took up BS chemistry at Far Eastern University, and then after the course, I proceeded at the same university, Institute of Medicine, and I took up medicine at that university at FEU, my alma mater. After that, then I proceeded to have my residency training in psychiatry, then followed by neurology.
So talaga beginning pa lang psychiatry na gusto mo?
Yes.
At the beginning?
Yes.
Sonia, may tanong ka?
Deb, alam mo, I'd like to know kung ilang taon na po kayo nag-practice? Matagal na? Kung ano po highlights ng practice?
More than 30 years now, no?
More than 30 years. Ano po ang masasabi niyong highlights of your career?
Of my career? Yes, well, I would say in the early part of my career, of course, from student until the early part of my career, at that time, my heart and my brain is really to focus on training, in order to make myself good in my knowledge of in the field of neurology and psychiatry. Okay, so then after so many years of practice, I feel that I need to devote part of my time for public service, to share my blessings. So in addition to the know-how in helping my private patients, I also devote a part of my time for public service.
So you have been practicing, how many years? 30 plus
I
years?
started in 1984.
84.
84.
And you've always been at Metropolitan Hospital. Where did you have your clinic?
Yeah, I'm also a faculty member of the Institute of Medicine Far Eastern University. I'm a faculty of the section of psychiatry in FEU, Institute of Medicine. Yeah, where I do my teaching there. And also, together with Ma'am Cora, we are in the World Association of Psychosocial Rehab Philippine chapter.
I also understand you do acupuncture, or you in your clinic that I don't know. Your clinic offers acupuncture. Is that correct?
Yes, I also do acupuncture. No, acupuncture plays a very important role in in psychiatric disorder and also in mental health. Acupuncture. It can be of great help. It's a kind of non-drug treatment. It helps in the treatment of anxiety, in depression, and also in insomnia. In
Wow.
in drug treatment, in drug abuse, with the use of acupuncture, we lessen the urge to use drugs, and also to alleviate the signs and symptoms of the withdrawal from these illegal drugs, and also from, let's say, alcoholism, also in smoking. Acupuncture helps in smoking, in smoking prevention, and also in smoking cessation.
Wow. Amazing. I didn't know that na pwede pala yan na smoking prevention or
Yes,
smoking cessation.
yes,
Pwede yun.
yes,
Oh,
yes.
wow, fantastic. Sonia, meron pa tayong provocative question kay Dr. Tan.
Hindi. Pwede malaman kay Dr. Tan, what is your specialty in the practice of neurology? Isn't it? Neurology. May mga, di ba, meron pang specializations?
Yeah, I'm in more of a in general neurology, general neurology. But in my training, I work in an epilepsy center.
Epilepsy?
During that epilepsy center.
Okay. Do we have many cases of this epilepsy?
Oh yes, we have many cases of epilepsy. Of course, in epilepsy, when we say epilepsy, what usually people know is the grand mal type, wherein the patient will be going to severe tonic-clonic. They will fall down, and then they go into tonic-clonic convulsion, violent movements. Those are very obvious type of epilepsy. However, there are some epilepsies, some seizures which are seemingly very minor or very mild, like let's say when I'm talking to you, like I have sudden blank stare, like just a few seconds of blank stare. Okay.
Yeah.
That's already a kind of seizure. Okay. Or some kind of seizure, we have so-called psychomotor seizure, wherein somebody will have some bizarre behavior. Let's say while I'm talking with you, I suddenly will have some lip smacking, and that scratch my head, and have some unusual behavior without then after. And during those episodes, I have no memory about them. So that's also another kind of seizure. There are many kinds of seizures or epilepsies.
So is it curable, Dr. Tan? Epilepsy curable?
In epilepsy, we don't use the word cure, but it can be controlled. Okay?
Manage.
Control it. And the treatment will take years. It takes several years to treat, or in some cases, it will be lifetime. But for patients who are well under control, it's as good as cure already. What is important is there should be regular follow-up with doctors, with the monitoring and adjustment of the medication. So with proper treatment, there's a good chance of treatment, of control.
And that these patients can live a normal functional life?
A majority of them can live normal life. They can practice their profession
Yes.
with proper treatment.
Yeah. Actually, Sonia and Dr. Tam, I have a cousin who's epileptic, but she developed her skill in embroidery, which is very fine sewing. And apparently it helped because it's like the rigor of doing the sewing, the embroidery made her functional. And but she still had some attacks. I suppose para ding ano yan, parang inaatake at certain points. I don't know when, but few and far between. And now that she's in her also 60s, hardly na inaatake. Parang na-weather na niya yung storm na yun at hindi na often na kasi 'di ba yun nagko-collapse tsaka nag-aano yung mouth parang
Ma-
oo, ewan ko ang tawag dun parang shock, parang nasa shock. Marami
Yeah.
ba tayong gano'ng pasyente na sa in the field in your practice? Do you have a number of those with epilepsy?
Yes, we have many cases. We have many cases. Okay. Although, of course,
Mm.
not as common as this common cold and other common medical problems, but we see them not rarely. Okay. And Ma'am Cora mentioned a very important point. As you said, your cousin is able to embroider to do these handicraft activities. I think the one important problem is the psychosocial aspect of epilepsy. In the society, we tend to have a stigma. We try to look down, or we look down. We have another kinds of negative view against people with or patients with epilepsy. I think epilepsy is a medical problem that can be treated. So we should treat them properly. We should treat them with empathy and with sympathy. So there's a good chance of recovery. In many cases, they can be treated properly. What is important is there should be regular follow-up with doctors, execution taking, adjustment of the dosage until we eventually uh, control the seizure.
Has medical science been so developed that in case of, let us say, epilepsy, it has been more manageable in recent years, Dr. Tan?
Oh yes, during the early part of my training, maybe dated back several decades ago, we just had a few medications, just maybe 4 to 5 medications. But now we have around 10 to maybe 15 to 20 kinds of medications with better safety profile and with better efficacy. Okay, so the treatment now is easier and more effective, and medications are maybe more patient friendly, less side effects. So,
Sonia, we're honored that Alice Bala, former chairman of civil service, sabi niya, having Dr. Tan as your guest is very enlightening and informative. The neurology, psychiatry, and acupuncture in one session. Thank you,
yes,
Doctor. Ibig
yes,
sabihin, all three in one. Three, parang
yes,
coffee, sugar, and milk. Three in one kayo, tayo.
yeah. I, Ma'am Alicia
Any more
Bal.
questions na provocative questions, Sonia? Gusto mong malaman kay Dr. Tan?
I think the stigma also that accompanies it, like
Yeah.
in our other sessions when we talk of mental illness, there is usually is accompanied by a stigma. So either they are isolated or ikinaiiyak, no, or the community feel
Yeah.
that they're ashamed, or modern times it's already accepted as an illness,
Yes,
epilepsy, no, that epilepsy though it is also maybe widespread, it can be treated, like an illness, unlike an illness, and can be managed. I think that's what I'm getting, Dr. Tan. Correct, Dr. Tan, that epilepsy can be well managed.
Yeah, can be well managed. Okay? What is also important is the awareness of the problem, and can be treated. Huh?
Can be treated.
Yes,
You mentioned
definitely.
earlier social function, of
Yes,
epilepsy.
yes. Many of them,
To
they will be able to function well. They can be professionals.
Pardon this question, but is medication expensive for epileptic? Mahal ba yung
Uh,
gamot na
yes,
iniinom? Kasi kung
yeah,
mahirap,
that's
baka
yeah,
hindi
that's a
nga
very
magamot.
that's that's medical medical economics. Okay. Yes, of course. We have those medications which are very cheap, like phenobarbital, which will be maybe just a few pesos per tablet, maybe just 2 or 3 pesos per tablet,
Mm.
and the others will be maybe maybe 10 to 20 pesos per tablet, something like that. Okay? Maybe around
And
20 to 30
you
pesos.
take that every day? Every day?
Yes, and they have to be taken every day. In average,
Mm.
maybe around 15 pesos or to 20 pesos per tablet, 2 3 times a day.
So 140 pesos per week.
Yes, yes. No,
140
no, no.
pesos.
Maybe a day patient probably will spend around, in average, around 60 pesos per day. 60 pesos per
60
day.
pesos per day.
Yes.
So that's like 1,000,
Maybe around
1,100 a
Kung
month.
maybe
1.5,
2,000 pesos per month.
Yeah,
Around
may
that.
2,000.
mga,
Yes. But of course, there
actually,
are also more
Okay.
expensive.
per month, mga 600, a little bit more. Will,
It's true that we have a lot of
yung,
generic medications,
Absolutely.
which make the medications affordable.
how about massage therapy? Kasi, parang, yung leveling, kumbaga, yung kanyang, um, ano ba tawag doon? Basta ano nila, pag minamasahe, they calm down. In other words, naging kalmado yung epileptic kung inaatake. How do you cope with the attack of
I think
epileptic attack or seizures?
yes,
They
I
call
think
it
yes, I
seizures,
think
di ba, Sonia?
Yes,
yeah,
yes.
Epileptic seizures.
I think you're talking about the, let's say, the so-called grand mal attack, wherein a patient will first lose consciousness, and they will fall down, and then they go into sudden stiffness, tonic seizure. Okay. So
Yeah,
in that case,
shaking.
during those times, in general, we don't massage them. We just
Ah,
let them lie down and make sure
go
that they
through.
don't hurt. Yeah, they don't have head trauma or hurt other parts of the body,
Yeah.
and let them go on with the tonic or violent seizure. And after a
Merong
few
iba kasi
minutes,
nilalagyan ng kutsara. Parang
actually
they
noted
will
that
bite
after a
on
few
the
minutes,
spoon, no? That old
yes,
style yon, ano? Yung
yes,
nilalagyan ng kutsara ang bibig para they can calm
but in
down.
general, after a few minutes, they will subside it will subside by itself. Hmm? So we really don't need
Ah,
to. Okay.
so ang answer dyan, just a matter of time. You just wait, no?
Yeah, just a
Anyway,
few minutes. After a few
oo.
minutes, it will subside.
Si Cecilia Sanyosa Restubon ito, from Bicol to, dating civil service, sabi niya, I will share this to the relative of my husband who has epilepsy. O, tama naman. Pero siguro, patingnan nyo din sa doktor. Si Edlin Nangcha, Sonia, nakikinig from
Oh,
Ihong, Santa Cruz. Si Maluyu, watching from Batangas. So, dumadami na nanonood, nakikinig sa atin. Sa
yung pwede,
pagpapatuloy, how
ang
about your patients are not all Chinese? Do you have a number of Chinese patients, Dr. Tan?
Yeah, my patients are both Chinese or Chinoy in
Filipinos.
Filipinos.
Yeah.
Maybe the Chinoy or Chinese maybe occupies around 30%. 70% are Filipinos. Yes.
Okay.
What I've heard or read about epilepsy is that sometimes the viewer, us who's not having the attack, we are the ones to panic more than the one having the epileptic attack, because the one having it does not have a word. It's not
Filia, not
aware.
conscious.
Di ba, Doc? Ganun ba yun?
Yes,
Can
sir.
you
Yes.
explain to us what is happening? Parang na-electrocute yata or something, kaya nagkakaganon. Ganun ba yun? Parang hindi ko eh.
Yes, sir. Yeah, in the case of grand mal, they first lose consciousness, followed by the violent body movement. So they don't know everything. They don't know anything. Okay, and so it's usually the bystanders who are in frightening state. Okay, and the patient himself or herself, they don't know. Okay.
Uh-huh.
Uh,
When they're suffering the attack, it's just parang normal for them, no? But it's the other people who don't understand the illness that
yes.
who become afraid, natatakot kasi sabi na they might kill themselves or
Tama.
parang maging life-threatening.
Yes, yes.
Ang mga natatakot yung mga nanonood sa attack.
Yung mga kasama nila sa bahay. Okay.
Yes. So
Important din.
we must raise their level of awareness na
Yes.
wag silang matakot pag inaatake
Tama.
yung
Usually
pasyente,
after
di
few
ba?
minutes, kusang titigil yun. Ano? Ang importante,
No,
make
pero
sure na
pero ano ang do you need to do something to calm them down or you just wait until the episode reaches its end? Anong dapat gawin ng somebody who is uninitiated in these
yes.
episodes?
Yeah, that is a very practical question. Ano? Usually important, tama sabi ni Ma'am, ano? Dapat maging kalmante and just make sure na kalmante tayo, ano? And hayaan natin magkaroon ng seizure kasi after 1 to 2 minutes, ano, in general 1 to 2 minutes at kusang magsa-subside po yun. Okay? So, huwag lang tayo magpanic, ano? We don't have to hold them, we don't have to do anything, ano? Kusang titigil yun. Ang importante, magpa-check up at have regular treatment. Yun ang importante. Ha? Kasi every time na may atake, nakakaroon tayo ng konting parang yung brain cells may konting brain cells na namamatay. Okay? So we don't want to have brain cell death, ano? So it has to be important may regular treatment para ma-prevent ang seizure and also to protect the brain cells.
Oh, wow. That's really
Kasi minsan narinig ko oy, hindi nakainom ng gamot, kailangan painumin ng gamot. Parang something like that na hindi pa nakakainom or pag inom ng gamot kalmado na. Ganun po ba 'yon, Dr. Tan?
Yes, important. Important. Saka importante kasi minsan yung mga ibang pasyente ang sumpong mga let's say once a month lang o minsan once every 2-3 months. So because of this minsan they tend to become carefree, ano? So pero kahit ang pinaka-advice is kahit na one attack only once a month or once every 2 months, kinakailangan every day mag-inom ng gamot para ma-control natin, ma-suppress natin yung mga abnormal discharges sa brain cells.
So,
Kasi
pwede,
even go ahead, Sonia.
so pwede, doktor, na sa kakainom ng gamot, nakakaroon ng seizures. Basta regular lang pag-inom, hindi nagkakaroon
Yes,
na.
yes, important.
Parang
Important.
na-controlled. So talaga pag inom ng gamot, kahit na ano naman, hypertension, kahit na anong gamot, yun ang dapat inumin.
Yes, yes.
Kaya nga ang tawag doon maintenance.
Yeah,
Ibig sabihin, you have to maintain. So sa epilepsy, ganun din. Hindi lang kung kailan aatakihin. You maintain, you give them maintenance para hindi sila atakihin. Is that correct, Dr. Tan?
Tama ho. Saka isa pang
Regular.
advice o isang warning, yung mga pasyente na may epilepsy, kinakailangan huwag silang magmaneho o try to avoid driving, kasi you can never tell pagka habang nagmamaneho at biglang mag-aatakehin, and it will be very dangerous, pagka malamang magkaroon ng accident, di ba? Aksidente, makabangga sa ibang tao, sa ibang causing problem, di ba? Loss of lives and properties. So, swimming, bawal ang swimming kasi mahirap na habang nagsuswimming, biglang atakehin,
So,
biglang mawala tao or during driving. Okay? Yes.
Ang nagiging problema, particularly for the poor, na may mga anak na may epilepsy, minsan hindi na pinag-aaral. Sasabihin
yes.
nakakatakot dahil baka atakihin sa school. Is that the correct attitude? Siguro dapat that should be corrected.
I think,
Kailangan matuto ang school how to handle kung merong epileptic na children. Shouldn't that be the attitude?
Yes. Yun na, kasi as I said, minsan madalas nakakaroon tayo ng stigma against these patients. So, with proper treatment, they can be normal student. Diba? Meron akong mga pasyenteng naghinto ng 2 years, and after seeing me, in-advise ko sila na ipagpatuloy yung pag-aaral. Sayang.
Yes.
Imagine they can, diba? So they can live a normal life naman. Okay.
And in your practice, have you seen epileptic? Kasi this is not known to many people. What happens to epileptic children? Do they die early or they also go to old age? And how old do they become before they're able to? Kasi baka hindi na matitreat, parang lifetime na yung sakit na epilepsy. Lifetime na ba yon?
No, kung with proper treatment, ang lifespan ng mga patients with epilepsy is just like normal people. Just like normal people. Okay? Especially with proper treatment. So they are no less than the normal people. Again, this
ang balita ko, Doc, si Julius Caesar daw, epileptic .
Sino?
Julius Caesar. Si Eleanor
Julius Caesar.
Si Eleanor Roosevelt. Yan daw yung mga famous na epileptic.
Famous figure.
Ito kayo, Dr.
Yeah, I'm not sure. My first time to learn about Julius
Ang galing. Not to worry. Because Julius Caesar was an epileptic. We can use that for those people suffering from epilepsy. Wag matakot. Si Julius Caesar, epileptic.
Eleanor Roosevelt. Eleanor Roosevelt, whenever daw she would have an attack, everybody knew how to handle it. They just let it pass and that's it. Ganon. Parang that's what I read.
But she was so brilliant. Eleanor Roosevelt,
Yes.
Pero baka kaya nagka-girlfriend si President Franklin Delano Roosevelt kasi inaatake ng epilepsy si Eleanor. Well, pardon my pun ha. Baka may magalit sa audience na pinapatawa ko but I mean it shows to me. I just want to prove an epileptic need not be down by the wayside, so to speak, because some of them can be truly brilliant as proven by Eleanor Roosevelt. Ngayon ko lang nalaman si Eleanor Roosevelt was also suffered somehow from epilepsy. Are there any other heroes? Baka meron tayong presidente na naging epileptic o nag-suffer ng epilepsy. Do you know of other great men and women na epileptic? Hindi. Wala na.
Wala.
Wala.
So we should not
anyway,
look down. We should not look down sa mga pasyente na may epilepsy.
But in the management,
should not feel inferior. Hindi dapat
but in your practice, Dr. Tan, in your practice, with this, we want to zero in on epileptics because many people don't know how to deal with it, di ba? So in your practice, how successful, what are your success cases na sabi nyong natulungan and they're now not 100% free from the seizures, pero able to lead productive lives? I think that's the question. That
Yeah.
in your
Tama.
experience, you've had
Oo.
patients who now live productive lives.
Yeah, siyempre sa epilepsy, meron din tayong mga resistant cases, ano? Pero sa experience ko, maybe more than 90% of the cases are well controlled. More than 90%. Okay?
Oh,
So let's say
good.
kung may 100 na pasyente, more than 90 na magandang well controlled. Magandang control nila, they can live normal life, they can be parents, they can work, they can earn money, they can be successful people. So
Kasi
magandang
the
success
people
rate is
ought to
quite
know,
yes.
people ought to know that epilepsy is not a mental illness, but
Mm.
it can have psychological effect to the people. And
Yes,
therefore,
yes.
di ba nangyayari pag may epilepsy, nahihiya
Yeah.
to hobnob
Hindi naman
yung
dapat,
people
no?
dahil
Is it,
baka atakihin sila. There is fear. Fear in other words, attending to activities or something like that. Di ba?
You want to add to the list of famous people?
yes.
Vincent Van Gogh. I'm looking here at Google.
Yes.
So Vincent
I'm
Van
sure
Gogh
marami,
suffered seizure. Margot Hemingway,
si
George
Hemingway.
Gershwin, George Gershwin, diagnosed with epilepsy, and even Einstein.
Wow, Albert Einstein, my favorite.
Si Einstein. Mm.
Ang galing.
Mm.
So I think it is not something that will stop people from becoming great.
Yes.
Yes.
People
I'm
become
not really
great
sure,
just
parang Beethoven yata, may epilepsy. I'm not sure. Maybe si Ma'am Sonia can check on it. Ano, si Beethoven.
here. I'm checking.
Parang,
Most
I'm not
people,
sure. Parang epileptic din.
Agatha Christie,
Yes.
even Leonardo
So,
da Vinci,
yes.
Ay,
So,
Leonardo da
this shows that,
Vinci.
this shows na hindi
Talaga?
dapat tayo
Baka,
maging inferior.
baka epileptic seizure yung
Yes.
kanyang painting sa ceiling.
yeah.
That's when he's most
No,
productive.
no, he's not the one who
Yes.
painted the ceiling. The last supper is Leonardo da Vinci. Michelangelo yung sa ceiling.
Yeah.
Okay. Mali ako. Ang
Tchaikovsky,
airport pala ng Rome, ang Leonardo da Vinci.
Peter
Remember?
Tchaikovsky. Oh, it says here Michelangelo also is in the list. And Charles Dickens. Wow, all the famous people.
I think there's isang magaling na a very famous very famous literature figure in sa Russia. I forgot the name.
Dostoevsky. Maybe Dostoevsky.
Oh yes, yeah. Also, an epileptic. He's an epileptic.
May tanong si si
Yeah,
Alice Bala, no? Is
yeah,
it possible to ask if Dr. Tan was a volunteer at DSWD NCR? I remember when I was NCR director, sabi ni Alice, we used to have a volunteer doctor, Dr. Tan Cho Chong from Chinatown Charity Foundation.
Yes.
Tama?
Ma'am.
Yan, correct,
Yes.
Alice.
Yeah.
Naging volunteer siya from Chinatown
Yes,
Charity
I
Foundation.
used to volunteer.
Thank you.
Thank you, Ma'am Alice.
you're correct. Beethoven
Sabala.
has epilepsy. Tama ka, Beethoven has epilepsy.
Beethoven.
Joan of Arc. Nako,
Joan of Arc.
even Napoleon.
Napoleon Bonaparte.
Yeah,
Wow.
all the famous scientists.
Yes. So this shows that dapat
So that means we should not look down on epileptic. It's just a condition. I think if
Yes,
you
yes.
see it as a
That can be treated.
condition, we will not be
treatable.
judgmental about their capacities kumbaga to do certain things.
Yes.
Sabi ni Jinky Bueno Ilion, mapagpalang araw. Si Joanne Mendoza Serrano, magandang hapon po, watching from Santa Cruz, Laguna.
Aha.
Meron pa tayong mahaba-haba pa ang tanong natin. Siguro, yun namang, kasi this is a program on mental health. In
Aha.
this pandemic, how do you think the people, particularly those left with very limited resources, how can they cope from in preventing um, mental health issues? Kasi syempre nagwo-worry sila di ba? Where to get the money for their work, where to Oo. Tapos sabi ni Nikki Coseteng, there is a school of thought in medical practitioners who believe drugs are not the solution and chemicals in drugs can cause things to get worse. So the dependence on drugs, no? Now, thank you, Nikki, if you're watching us, no? Tama, no? Uh, it does not mean that everything can be solved by drugs. There can be other options, and that's even positive relationships, family, etc. Tsaka I guess pwede ding iba-ibang sources of gratification that enables them to cope with whatever pressing problems they have. Ang nakikita ko diyan, I guess, there must be love. Love sila ng family, love sila their friends who love them. Kasi without love, baka madaling ma-depress sa aking palagay.
Ano,
Yeah, it's
Cora?
true.
Tapos,
Ano?
oo.
Tama, because of the COVID, because of the social isolation, ano? Lalo ng mga bata, no? Nakakulong lang sa bahay. Because of this, they feel irritable, ano? So, and also even adults, ano? We feel isolated and nakakainip sa bahay, ano? So maybe we can do something like regular exercise, ano? Doing regular exercise is also one way for mental health, ano? Listening to music is also one, ano? Okay? And of prayer and spirituality, okay?
Yes.
It's also an important part of mental health, ano? And also siyempre because of the quarantine, ano, nagkaroon din tayo ng opportunity for family members to be together, di ba? So it's an opportunity for us to make use of this to have bonding together, ano, like watching movies together, music together, and maybe sa online, sabi niya, mga online spiritual activities, online mass, online prayer. So ito yung mga activities na pwede natin gawin para sa mental health natin, ano? And spirituality is important part of mental health, ano? And of course, in some severe cases, ano, we may need some drug treatment, ano, like some low dose medication to relax our mind, ano? For patients with depression or sometimes with suicidal problem, we may need antidepressants. Okay, we may need professional help. But in general, some of these are the one na binanggit ko kanina, no? Like prayer, exercise, music, spiritual activity, or maybe even online socialization, ano? Yun yung they're part of the resilience promotion for mental health. Okay.
Sabi ni Nikki Coseteng, like in the Glenn Doman Institute in Philadelphia, USA, their medical professionals wean children from drugs first before working on them. And their success rate is quite good without the use of chemical drugs, but rather brain exercises and other non-drug therapeutics. There are also doctors who work on the diet of the patients to minimize seizures. They have centers worldwide. There is one in Singapore and Jakarta too. I attended their seminar. And this also being given to parents here as an option in the treatment of their children. I have friends who have successfully kept seizures under control with minimal or no use of chemicals. Good question, Dr. Tan, from Nikki
Yeah.
Coseteng.
Yeah, thank you, Senator Nikki Conscosete. Thank you. Yeah, you emphasize greatly on the non-drug treatment, ano? Yeah, relaxation, spirituality, and proper diet, ano? Proper diet, important yun. Kasi nowadays, ang daming mga junk food, ano? Mga junk food, fast foods, ano? They are actually hindi healthy sa katawan natin.
So, Dr.
Pero ang advertisement ng mga junk food, mas malaki, mas mataas. They're
That's a
spending
social
a lot
problem.
from
Yes.
advertisement, ano?
The social
Kaya-
media.
may I ask Dr. Tan, is epilepsy a physical illness or a mental illness or none of both or both?
Yeah, essentially, it's a medical problem. It's a physical illness. It's a
Physical.
physical illness involving the brain. That's why we say it's a neurological problem. But because of this, ano, siyempre, yung iba as binanggit natin kanina, ano, na nagkaroon ng psychosocial stigma, no?
Yes.
Which is a wrong attitude, ano? So we should, number one, yung pasyente mismo, kailangan may positive attitude sa sarili nila, no? Hindi dapat sila magkaroon ng inferiority. And tayo naman, mga friends, relatives, we should adopt a positive attitude to help them. Okay? So, but of course, in some of the epileptic cases will present with behavioral manifestation, ano? Okay? But still, they can be treated, ano? Like, let's say, during the episode ng seizure, something which we call psychomotor seizure, they may present with some psychological problem by sudden shouting or with some bizarre behavior. Okay, but again, they can be treated. Magagamot naman.
Salamat. Galing.
There is really hope for the future. Basta we
Oh,
know
yes,
how to
definitely.
deal with the problem.
Yes.
And it's not only the patient, it must be
Yes.
the whole family na
The family,
engaged in the helping process. Kasi minsan, naisip ko lang na ina-isolate yung tao na this is a special person, a special child,
No, yeah.
special family
Exactly.
member na para bang natatakot ang family to deal with them like
Yes.
normal people.
Uh-huh.
Parang they make it an abnormal situation.
Yun nga.
Oo.
Hindi dapat,
Si Alice Bala nag-text ulit. It's nag-like
thank you,
ulit.
Ma'am
It's
Alice
nice
Bala.
to see you, Dr. Tan, and we valued your time with us. You really helped us a lot, especially our social workers and house parents in managing, sabi niya, in
Thank you, Ma'am
managing
Alicia
and
Bala. I
understanding
hope
the
to see you one
dynamics
day.
of our children with special needs in LC Gatches. Sabi naman ni Nikki Coseteng, we should encourage parents to accept that their children need professional help. Many
Yes.
many don't seek help because they are in denial. Tama din naman
Yes.
yun. Ayaw
Yeah,
tanggapin na meron. Ay, ano lang.
Yes.
Thank you, Nikki, for posting that. No?
Thank you,
Kasi
Senator
yun,
Nikki.
yun. Yeah. Maraming kaibigan talaga si Dr. Tan. Ang daming
Yeah.
ang daming
Yeah,
nagla-like
I'm
sa
happy
atin
to
na
meet old friends.
personalities,
May 30 years
Well,
ka lang sa practice.
Yeah.
meron na lang tayong 5:48 na. We need how many minutes na lang mga so ano na tayo? Thank you na tayo. Sonia, start muna sa'yo.
Oo, maraming salamat, Dr. Tan. Marami ako natutunan sa
Maybe.
share niyo. It sounds
Whatever I can be of help, don't hesitate to let me know.
Oo, I'm sure na all our listeners also
Yes,
learned a lot from you. And what is really very good about this afternoon's discussion is that you've taken away the fears that we have
Yes.
to become, and that there is a way to treat epilepsy.
Yes,
But
it's treatable.
illness.
Yes.
It is a physical illness, and if it becomes like psychosocial, then that is another development But as it is, epilepsy is a physical illness of the brain. Yeah. So all of that po, natutunan ko sa inyo. Thank you very much for
Yeah, thank you.
your time with us and your wisdom and your experience. We can have you
Yeah,
again.
thank you. I'm happy I'm able to do a little help. Uh,
Ah, thank you very much, Dr. Tan. And for
Thank you
you,
for
I
inviting
think
me.
appropriate itong poem na ito na unless someone cares. I think kailangan sa mga epileptic, we have people who care for them. I don't think
Yes,
our
yes.
communities will ever be clean and green unless someone cares. I don't believe our government will be good, just and honest unless someone cares. I don't expect our leaders to be morally upright and politically sensitive unless someone cares. I don't expect a better life for our poor and oppressed people unless someone cares. I don't have the faith that we face a brighter future unless someone cares. I don't feel we will ever realize our dreams and aspirations unless someone cares. I don't know if we will all live our sense of purpose to build a better world unless someone cares. That someone is us, that someone is you and me, that someone is everybody, for we all must care. And today, that someone is, of course, our Inangguro Sonia Rojo, si Dr. Cho Chong Tan, and of course, our guest in Facebook, Nikki Coseteng, Gina Lin Insyong, and of course, Alice Bala, and Mylene Smile, and Joanne Mendoza Serrano.
Mama.
Maraming salamat and finally, itong ating quote na binabasa from Rabindranath Tagore. Magagalit si Rabindra pag hindi ko binasa ito. Where mind is without fear and head held high, where the world has not been broken to fragments by narrow domestic walls, where tireless strivings stretch their arms towards perfection, where the mind is led forward to thee into ever widening thought and action, into that heaven of freedom, my Father, let my country awake. Totoo, nagising tayo at sabi ni ah, ni Nikki, may remark po siya. Great to see you, Sonia. You have not changed. Wow, maganda. O sige, this is all for now, folks.
Yeah,
Until next Tuesday, we will dwell again on another topic related to mental health. Because mental health is really good health. Maraming salamat sa inyong lahat.
yeah.
Humabol si Celia Capadocia Yanko. Very informative session. We should try to disseminate the learnings in our barangay, especially in far-flung areas. Totoo naman, paano madadala sa far-flung areas? Kailangan yung nakarinig, magsabi kung paano nila may de-disseminate ito. Maraming salamat uli and see you again next Tuesday.
Thank you,
Mga
Ma'am
Bye-bye.
Cora.
listeners.
Ma'am
Bye-bye.
Sonia. Thank you.
Thank you.
Bye-bye. Thank you.